Hello and good evening, everyone. My name is Carl, and this is my presentation for PBH 429 on our semester project. I chose the STI PowerPoint presentation, and my STI of choice that I'll be discussing today is chlamydia. So, just a general overview of chlamydia is that it's one of the leading STIs in the United States and worldwide. It's known as a silent infection due to the fact that 50 to 70% of the individuals who get it transmitted to them do not notice the symptoms until they have reached their severe stages. The bacteria that is transmitted through this STI is known as Chlamydia trachomatic, and this bacteria is generally transmitted through oral, sexual, and anal sex via semen and vaginal fluids, and some rare cases of transmitting this bacteria is through the sharing of sex toys. It's not exclusive to one gender, so this bacteria is common in both men and women. It is disproportionately more prevalent in Hispanic and African American communities. An infection point of contact is during intercourse, but the infection lies in the urethra. An important note about this STI is that it's not transmitted through kissing, hugging, or sharing of drinks, as well as using a toilet after someone else who does have the bacteria. Some risk factors for getting this transmitted is unprotected sex. Individuals between the ages of 15 through 24 are more susceptible to getting this bacteria, as well as having multiple partners. Male to male sex is a high risk factor for getting chlamydia, as well as anal sex. Hispanics and African Americans are of higher susceptibility due to culture, as well as highly sexually active individuals. Um, Education plays a role in risk factors as far as chlamydia goes as well. More education means you have more information with STIs, and you're going to have more of an idea on what to do as far as proper sexual practices and whatnot. Lack of access to proper healthcare is also a major risk factor for chlamydia due to the fact that a lot of providers do provide contraceptions such as condoms in order to promote safe sex. Some risk of infection when not treated is that it can cause infertility in both males and females. For females exclusively, it may cause pelvic inflammatory disease, which can produce chronic pain and infertility. And in males, it causes swelling, inflammation in both or one testicles, as well as chronic pain. If a female was able to bear a child and overcome that infertility, it may transfer over to the child when left untreated. Some symptoms of chlamydia in women is white, yellow, or gray discharge from the vagina, accompanied by increased and painful urination. Pus in the urine may also be present, and itchiness and a burning sensation around the vaginal area, as well as bleeding when not on your period, are common symptoms, as well as painful intercourse. On the other hand, in men, chlamydia tends to produce a watery mucus-like discharge, painful urination, and testicular pain and swelling. For both men and women, for those who do partake in anal intercourse, it can produce buttocks discharge, and when bodily fluids make contact with the eyes, it may cause conjunctivitis, which may cause pus in your eyes, as well as some mild swelling. Incubation period for chlamydia is 7 to 21 days, but may take up to several months. But the most common cases reported took anywhere from 7 to 14 days. Some treatment options for chlamydia is that it can be treated pretty fairly quickly with some broad spectrum antibiotics such as doxycycline or azithromycin. Doxycycline is preferred by many providers for an elongated treatment. Azithromycin is preferred as a swift treatment because it's usually just taken as a single dose and it's a common treatment in countries with heavy sexual trafficking. Abstaining from sexual activities for at least 7 days after beginning treatment is recommended. And after being treated, it's recommended to get an STI screening at least once a year. Some prevention options, as mentioned earlier, are STI screenings, protected sex using contraceptives with physical barriers such as condoms, abstinence, abstaining from having multiple partners, not sharing sexual toys, and practicing post intercourse hygiene, as well as sexual education courses and research. Prevalence of chlamydia in the United States was about at 1,700,000 in 2022, making it the most prevalent STI that year. That accounts for about 495 per 100,000 people in the United States. Prevalence is slowly decreasing in women after 2022, and it's at its highest in adults between the ages of 15 to 24, making up 57.7% of the cases. And this is my reference page. Thank you so much.